Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Best sacroiliac pain relief available, self-treatment. This is something you can do yourself at home, and it's all based upon this book, isn't it, Brad?
Right, and it's a well-written book. As Bob and I and any therapist know, SI or sacroiliac joint pain can be challenging to treat.
It can be very challenging.
Right, and there's a number of different methods to do it, but this book I think is written very well for the layperson. My wife was reading it, and she's not a therapist, and the only thing she knows about therapy is from me, and she kind of, you know,
Sure.
I keep the work away from at home, but she is reading it, and she says it's well written, she could understand it, and it made a lot of sense.
She's not having SI pain, is she?
Well, no, but she has some related pelvic floor issues that this book also addresses a
Oh,
little bit.
interesting. So yeah, it's by Deborah, we're going to say Rixo.
Rick, so I hope we're pronouncing it right. She's
Apologize if
right,
we didn't. Yeah, she's a PT.
doctor of PT, and she's got this method. She calls it the PGM, Pelvic Girdle Musculoskeletal Method. She's developed, she's spent a lot of time with it, and it's a good book. So we're going to go through the first part of this
And
book.
we got a link down below. We'll have a couple links to this.
Right.
But, so you can go ahead and...
All right, it's not very much, $12.95. It's a
So
good price.
we're not going to do it complete justice. We'll just kind of touch upon some of the things, right?
Right, the initial, explain the SI problem, and then her first phase of strengthening it, which I think is a really good start.
Good.
And something you can do at home. So, first thing is the SI joint. Sacroiliac, it's a mouthful. I know my mother used to talk about this when I was a kid, and I didn't know what that big word was.
Well,
I don't think she did either.
A lot of people interchange it with back pain.
Right.
You know, they think they have SI pain when they just have regular back pain.
Right. So the sacroiliac joint, if you look at it on Sam here, how we doing? Lonnie, you got her in here. We're going to look at right down here.
Right in here.
Right, just kind of focus in this area. And the sacral refers to the sacrum, so that's just
Kind of a triangle-shaped bone.
right. It's a vertebrae that have fused together.
Right.
It's a solid mass of bone, and then your ilium, the sacroiliac. This is an ilium here and one here, and the joint is here. You have two SI joints, one here and one here. And these joints aren't like an elbow joint or a knee joint. They don't move freely.
They have very limited movement.
Very limited. As a matter of fact, there's some controversy. I went to one
Whether or
course
not they even move at all.
whether they move at all, because there's a lot of ligamentous tissue holding it, muscles, everything holding together, so it keeps that pelvis solid. However, in the case of females with pregnancy, with some hormonal changes, then I think
They
it's more
affect the ligaments and
Right.
they actually stretch out a little more.
right,
don't they?
and then it's more accepted by everyone that there is motion at that point.
Sure.
In that situation.
And often pain along
Oh,
with it.
right, yeah. I guess we don't know about
We don't know
that. But we've heard about it for sure. So that's the area we're talking about. And what Deborah has done, she's come up with a system to initially assess and how to determine which exercises, strengthening exercises to do.
So depending upon where the pain is at,
Right.
that is where you're going to do, that's depending on which exercise you do.
Right. And I do
Okay.
want to take one step back and talk about some of the causes of SI pain. One can be related to pregnancy, particularly, during or right after pregnancy when things are coming back together. Another one is if you fall and you land right here on your sit bones or your ischial tuberosities, you can see that's part of the pelvis. If you landed here, you can see how that could shift the SI joint.
Sure.
Or stepping off a curb.
Yeah, especially one-legged and taking a jolt.
Yep, and that jolt goes through one side and can shift an SI. Okay. The other car accident, when you go into your knees, go to
sure.
the dashboard. That's another one. So any of these things could happen.
I used to read just people who just sit abnormally at one side like this
Sure.
can actually, over time, kind
Yep,
of adjust the SI.
Symptoms, typically pain in the back, one side. Oftentimes it can refer down, typically not below the knee, but through the thigh and the back of the leg. So if you have that and you think you have SI, you've been diagnosed it, and you want to do self-treatment,
Yeah, this is the book
this
for you.
is the book. So again, as we alluded before. But you know something, Bob?
Oh, but that, we haven't even
Oh,
welcomed our family
wow,
back
what
in here.
happened?
Yeah, what
Welcome
happened?
'em in, you know.
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. Also, if you get a chance,
Oh, I'll get it, Bob.
go over to the Facebook and like us, because Brad and I, we're on a mission here to try to get likes. Since as children we were not liked, so we're turning things around. We're snapping things around.
There you go.
Okay.
Let's get the book. Well, you know, the thing is with the SI joint, you get so immersed into it. I think that was the thing.
Yeah.
You know? We just kind of were interested. So what she's saying is palpate is what we call it, or push on certain parts of your body. And the specific spot are right here. If we look at Sam.
So on me, that would be about right here.
Right.
It's going to be a little bit hard to find some of these, maybe.
Right.
Yeah.
But there's a bony spot
Yeah,
right
bony
there,
spot
usually
right
about
there.
just above the belt line, right here. And then the pubic symphysis, which is the bone where the pelvis connects, right here.
Yeah, right
And then
down in there,
yeah,
yeah.
and you're going to push there, and then on the back side, where the SI joint actually is, the PSIS, the posterior iliac sacral.
The posterior superior iliac spine.
There you go, thank you. I knew that was a mouthful. A little nervous on video, you know. But you want to push there as well. Now, if you find point tenderness, it feels tender on the right side.
In any one of those three spots, or just all three spots?
No, or two of them, at
Two
least
of them.
two of them.
Okay.
Okay,
So if you
on
find
one side or
Sure.
the other, then we're going to start with exercise number 1. If you find it on all the spots or none of the spots, then you're going to skip number 1 and go to 2. So we'll do exercise number 1, assuming you found.
And this is all explained in the book.
Right, step
Okay.
by step.
All right, so you're going to go with finding it on one side first?
Right.
Okay.
Yep, exercise number 1. This one may be skipped again. All right.
You want a pillow, Brad?
Yeah, I'll take a pillow.
Okay.
I'm going to need it for something else later. But you're going to lay, and you're going to do this preferably not on a bed. Be best done on a carpeted floor, unless you
More
got
of a solid surface.
Yep, but not hard. You know, a hard floor would be uncomfortable. And you're going to take the left knee, not the right one, only the left. You're going to get it in a position like this.
Is that if the pain is on the right side?
Doesn't matter.
Oh, it doesn't matter.
Right, yeah, that kind of surprised me. I looked it over.
No
and
matter what side the pain is on, you're going to take the left knee
Right,
first.
right.
Okay.
There's exceptions. She said if you're working with a therapist and has done a more thorough evaluation, they may change it up.
Sure.
But for self-treatment at home, only the left. And you're going to push this knee up this direction.
Gotcha.
And here you're going to hold it. So it's like a muscle energy technique.
Sure.
MET, as we call it in the therapy world. And you're going to push, do an isometric there, and lift up the buttock at the same time. And she goes through the breathing. And then you're going to exhale as you go
So
down.
this is being pushed this way, and the butt's being lifted up. Just
Right,
To
yep.
repeat.
Good. And with that, you're going to do that 10 to 15 times.
Interesting. I have not seen this one before, so
Sure.
I do find this interesting.
And if it hurts initially, do a few more repetitions. And if the pain decreases, that's good. If it hurts and it becomes more painful, you're going to stop after a few repetitions.
Sure, and this is like our philosophy with almost everything. Is,
Sure.
You know, we want to see that it's going to start getting better by doing the exercise, and if it starts getting worse, obviously we're going to back off.
Right,
It's not no
precisely.
pain, no gain. It's not we never have that philosophy.
Okay, then the next one. Now, if you didn't have pain on either side, you'll skip that one. If you had
Okay.
pain on both sides or no pain on those points, then you're going to start. This is
So this is number 2, unless you had no pain on both sides, then you would
you'd go right to this one.
right to this one.
Yep.
But either way, this one, you're going to do this one at
Right,
some
yep,
point.
either way you're going to do this. And we just call this a clamshell is what I call
Okay.
it. You're going to go out like this. The only thing that she mentions, and the specific thing is, look at my toes, Bob. When I go out,
Oh, your toes are spreading apart.
yeah, I'm pointing them out that way.
Okay.
And then as I go in, the toes
Oh,
point
toes
in.
are coming in.
Yeah, so,
Interesting.
yeah.
So you don't do clamshells on your side.
Nope,
You're doing them?
supine.
Yep.
Yep,
So he's spreading his legs
Right.
apart, spreading his toes apart, bringing his knees together, bringing his toes together.
right, precisely.
Gotcha.
And up to 30 of these. You know,
Wow.
this is you know, low intensity, obviously, so we can increase the repetitions. Now, if this feels fine and you want to increase the intensity, then we need to put some resistance. And if you get a loop band,
So we got the Sank band, and
Yep.
again, we got that listed in our Amazon list
Now,
too down below.
If you just had a stretch band,
You could
could
tie
use-
it.
tie a knot,
Yeah.
and that worked too. You're going to put that around the knees. You could use a soft ball. She recommends a pillow, so I'm going to stick with, so I'm consistent with her.
recommendation?
Yep.
So you got a pillow between there
Yep.
along with the,
And then we're going to continue on with the same exercise. We're going to clamshell out, toes point out, got some resistance, and then as we come in, we're going to toes in and squeeze.
so you get a little bit of resistance from the pillow too.
Right,
So
precisely.
resistance going out,
Yep.
resistance going in.
There you go.
Repeat again, toes going out, toes going in.
Yep.
So, wow.
Yeah.
These are
So
all new to us.
now,
So very interesting.
the next thing, but and I can understand where she's getting at as far as strengthening the muscles
Sure.
in the pelvic area. The next one, same thing,
Oh,
but
wow.
you do with a bridge.
Pretty intense now.
All right, so that changes it. So you're getting stronger and you make the exercises more intense. But again, the same motion with the toes.
Toes are going out
Yep.
again. I could see where you'd almost want to do that with stocking feet, wouldn't you, Brad, or not?
Well, yeah, I think
mean,
that
you're-
would be.
The shoes are gripping a little bit
Yeah.
on you. I can
As a
see.
matter of fact, in the book, there's some links to some videos that you can go on, and her daughter's doing them. She probably does them better than me. She's
Sure.
better looking than me. You're better off going
Well,
there.
that's
than
not saying much. But
right. Yeah.
All right, good, very good. very
Okay.
excellent. So,
Now the next thing, there's one more.
all right.
But wait, there's more. You
Thank
know how
God.
that is. And this is a very interesting stretch. You're going to take a chair. It's real important on this one that you sit flat, good tall posture. Make sure your sit bones both are flat on the chair. So
And
a
level.
firmer chair would be better.
Sure.
Yep, so you don't want to be crooked. You're going to take one leg and bring it up to here, not on your knee, but on the chair.
Okay.
Okay? If you don't have the flexibility to do this, you can get a stool.
Which leg would you start with? Doesn't matter.
Right, you're going to go both of them
Oh,
in both
okay.
directions. Yeah, bring that over here with
So
Bob.
he could do a
It-
lower level on the
yeah,
stool.
if you don't have the flexibility in your hip, this is, it might be a little lower than that.
Sure.
You could use that option as well.
Sure. I don't know if I can do that or not.
All right, so we get in there, be good and square, and then you're going to rotate. If the right knee's up, you're going to rotate to the right,
Ah,
and you're just going to give it a little bit of a stretch.
so you're grabbing onto the knee and pulling yourself a little bit?
Right, yep. Little stretch there, and then you're going to relax. Now with this, you're going to let pain be your guide. If this creates sharp pain and it doesn't reside or go away after a few repetitions, it's too early for it. Or
It's
not the
interesting
stretch
because
for
I think
you.
this is what sometimes causes SI problems. People who sit sit kind of like this, where they
Right.
sit on their leg like
Right.
this. You know what I mean?
But
But it can also treat SI problems.
right, and I
obviously.
think you're not sitting on the leg. You're not.
No,
there
no,
very
I
long.
understand that. I understand that.
And she's working, I think, at stretching some of the lower back muscles as well. The
Sure.
stretch like that, and then of course we're gonna
Go
do
the
the
other
other
direction.
sides. Yep. Okay. Ooh, I just had a nice little cavitation in my hip there. That felt
Wow.
good. Yeah.
Was that your problem hip that you had? Remember you had problems that one time with your hip?
Yeah, I think it was.
Ah.
Yeah, it's amazing.
You actually seem to have pretty good range.
Yeah. I don't know. The old hips are loosening up a little bit, Bob. So those are the strengthening exercises that she has, and that's the stretching there. But then she goes on and talks about proper breathing, core breathing, to get the pelvic muscles integrated in with your breathing and how to breathe relaxed. We talk about the diaphragmatic breathing. And then from there, she goes into some stretches in the hip and then a walking program. So it progresses you directly
So we
through.
really just touched upon things here.
Right, we
Brad,
just
right?
got the initial phase, because
Sure.
if we went through the whole book and gave it justice, we'd probably have a 30-minute video, and you know.
Right. And we want to give her some, love here. She
Right.
she came up with this book. We should again we'll promote it. The Sacroiliac Pain, Understanding the Pelvic Girdle.
Show the
Musculoskeletal
show
method.
the camera, Bob.
Here we go. Well,
Yeah.
they'll see it down below, Brad.
Oh,
They just
that's
got a link
right.
down
Yeah,
below.
her and her daughter did a really nice job on this book, so it's a super job, and we'd just like to promote things that are done well.
All right, thanks, Deborah and daughter.